When getting involved in clinical education, there are some terms that you will hear commonly as you go through this process. We're going to take a look at some definitions that are published in the American Council of Academic Physical Therapy Clinic Glossary, which is a resource of standardized terminology. First, what is a clinical experience itself? You might have heard the terms before, rotation or affiliation, but ACAP uses the term clinical experience, which is an experience that allows students to apply and attain professional knowledge, skills, and behaviors within a variety of environments. Experiences include those of short and long duration, so some are part-time, some are full-time, there are varying levels of weeks, and they all provide a variety of learning opportunities and include physical therapy services for patients across the lifespan and practice settings. There is also further categorization into first, intermediate, and terminal. The first experience is first, that one is straightforward. An intermediate experience is another full-time experience, but the student still has more didactic coursework to complete upon completion of their experience. And a terminal experience is after completion of the didactic curriculum, and the student is expected to perform at entry level because that is the final experience during the course of their program. Now, who are the main stakeholders in this process? The Director of Clinical Education, you'll also see the abbreviation DCE a lot, is an academic faculty member who is responsible for planning, directing, and evaluating the clinical education program for the academic institution, or the DPT program. So this is the point person to contact at the institution itself regarding anything student-related. The site coordinator of clinical education, I also see it as SCCE, is a professional who administers, manages, and coordinates clinical assignments and learning activities for students during their clinical education experience. So this is the point of contact at the clinical site regarding anything student-related. And then you have the clinical instructor, who is the physical therapist responsible for the physical therapist student and for directly guiding, instructing, supervising, and formally assessing the student during the clinical education experience. So the CI is the one that's working directly with the student on a day-to-day basis. Students are evaluated during their experiences with a clinical performance evaluation tool, which is a valid, reliable, and multidimensional clinical performance assessment tool utilized to determine if and how well a student meets established objectives during their experiences. So there's more than one established assessment tool out there, so it's good to find out which one the student's program utilizes before the experience starts. And it's also good to find out what benchmarks for performance the academic institution is expecting for that experience.